Good morning, Ruby.
Good morning, Lloyd.
Well, I've gotten connected here. See, you're letting people in, right?
Right now we have seven attendees. Well, 8. They're coming in.
They're coming in. Good. Took me a moment to get in myself. And I've still got a couple people asking about joining. So I'm going to go to my mailbox and send the registration link. And you will be allowing me to share my screen, correct? At some point.
Yes, you should. Do you see the ability to share screen?
Just a second here. I'm sending. Do one thing at a time. Yes, I see that. Okay. Okay. Are you seeing my title page?
Yes, I can see it.
I think we may be set on this end. What do you think?
What was that?
I say, then I believe we may be set on this end. What do you think?
We're good to go. Can you see the Q&A polls and chat bar at the bottom?
I can see, well, mine right now with my screen sharing is coming in at the top.
Okay, that's fine.
Q&A or chat? I guess does it show up as chat or Q&A? On my
It's
screen,
both.
it says Q&A. Okay.
Okay. Well, I'll manage both.
Oh, there's chat. Okay. Good. Thank you. Let me see. 16 participants. Give people a bit more time. Welcome, everyone. Thanks for coming in this morning. It's 10:01. We'll give people another couple of minutes and then we'll get started. Try to manage my time here. I do have that screen there. Ruby, have you started recording?
Yes.
Okay.
Ricky, do you have a question?
You know, I always have a question. Did you want us to use the chat box or the Q&A box for questions?
If you have any questions for me regarding any technical issues, use the chat box. Anything specific to the content, put it in Q&A, and we can answer from there. Okay.
Thank you so much.
You're welcome.
All right, we are up to about 25 participants. I think we're going to get started. We'll probably have a few people continuing to join us, but that will be okay. Good morning, everyone. This is Lloyd Schmeidler, Senior Analyst in the City of Durham's Community Development Department. Thanks for joining this introduction to our workshop series for 2021, which we've titled Effective Case Management in the Homeless Housing System. This morning, we'll do an introduction to the series and a brief overview at the end of what we have in mind. We'll be inviting you to participate in various ways throughout the session, and we will be ending one way or another by 11:30 a.m. Thanks so much for joining us. To begin, I'd like to share briefly, I know there's a lot of new people whose names I do not know very well, who have joined our system over the last year or two. And particularly during these times of social isolation, we've not had a chance to meet in person. So let me say briefly about myself that I have been working with and for homeless people since 1994. For the first 5 years in rural Colorado, and since 1999 here in Durham. I was the Director of Urban Ministries downtown from 2002 to 2008, and since 2009, I have been working as a staff member for the staff support to the continuum of care, and since 2011, so for the last 10 years, through the City of Durham's Community Development Department. So I have been around a while in Durham and have a few thoughts and have some institutional knowledge, I would say, about Durham's history, particularly over the last 20 years, in responding to the needs of people experiencing homelessness. To begin, also, I want to acknowledge the contributions that a number of partners have made to this presentation this morning that I'm going to go through. Drew on some of the training from the Back at Home series of trainings that North Carolina Coalition to End Homelessness and the state ESG office have put together to use ESG CARES Act funding. Also want to express appreciation for the work that our partners at the NCCH Data Center provide to Durham with managing our HMIS and pulling together information for our annual system performance measure reporting. And then also I've used some information from resources from the National Alliance to End Homelessness, as well as a wonderful series of case management training for homeless case managers that is published online by the Florida Housing Coalition, and some of the upcoming presentations will be taking the titles at least from some of their trainings. Hopefully everybody can see my screen. If you can't see my screen, please let us know. In preparations, orientation, hopefully by now you're familiar with using Zoom. We are corrected. We have two functions this morning to use, chat and the Q&A box. And so Ruby, who is providing wonderful technical support to me and us in this series this morning, indicates to use the chat box for technical issues. If you can't see something or can't hear anything, use that, but otherwise use the Q&A, and I'll try to correct my language as I invite you to share in the Q&A. And so to begin, if you would introduce yourself in the Q&A box with your name, organization, the organization that you work with and for, your role there, title of your job,
and then one word that describes people experiencing homelessness. And again, use the Q&A box to record questions or offer your perspectives throughout the presentation. I've become adept in various Zoom meetings to simply put in questions or perspectives, and we don't need to be shy. It's difficult, as we know, to have a conversation in this kind of format where we can't see each other, and I can only really see my PowerPoint presentation screen. And but we will have opportunities, hopefully towards the end, to perhaps have some people raise their hands or otherwise participate or respond to some of the questions. Also, as questions come up for you that may or may not relate to this presentation, but they are related to perhaps other future sessions, feel free to raise those, and we will get them to the presenters for future workshops. One good thing that perhaps some of you are relieved at is you will not be listening totally to me throughout the year in these workshops. I've lined up a number of other speakers and presenters to lead various sessions, and we'll continue to do that. I have a few sessions still in the latter part of the year that I'm working to arrange presenters for. If you've not already done so, please mute your microphone, except when you are recognized to say a word or ask a question. And to be clear, the workshop is already being recorded and will be posted on our COC website. Let me see, why is my screen not forwarding? There we go. Hopefully you've taken a moment to introduce yourself in the Q&A box. So Ruby, I'd invite you to give us a brief overview of people who are with us this morning, sharing their name, role, organization they work with, and one word that they might have put in the Q&A box to describe homeless people.
We have Mary Barr, Triangle Empowerment Center. I think I got that right. Demetria Benjamin, Housing for New Hope, Housing Stability Case Manager. Her one word is hopeful. Shaniqua Smith, Housing for New Hope, Engagement Specialist. Alexandra Nelson Thomason, Open Taylor Ministry, Resilient. Ricky Gardner, Housing for New Hope, Government Affairs and Compliance Manager. One word, human. Community Linkage Coordinator. Brittany Bass for CPSS. Ronald Roper with Triangle Empowerment Center, the Community Linkage Coordinator. Valerie B. Messick, Case Coordinator. Colleen Herbert, NCCU Office, Community Engagement Director. Her one word is people. Christy Page, Director of Client Services, Housing for New Hope. One word is resourceful. Paul Grabowski, Transition Specialist, Life Skills Foundation. One word, unheard. Tisha China, Urban Ministries. Valerie Messick, Triangle Empowerment Center. Michael Conroy, Life Skills Foundation. MSW grad student, therapy intern, one word, persevering. Kristen Rogers, Housing for New Hope Program Manager, one word, resilient. Beverly McGill, Clinical Case Manager. Ebony Thomas, McKinney-Vento Coordinator for Durham Public Schools. Rebecca Bourgeois, Housing for New Hope Street Outreach Neighbors. Desmond Godfrey, Community Health Counselor with Triangle Empowerment Center. Homelessness is preventable. Megan Holmes, Family Services Coordinator with Families Moving Forward. Shanita Mills, Housing for New Hope, Housing Resource Coordinator. One word, people. Rosalind Smith, Families Moving Forward, student intern. One word, family. Beverly McGill, one word is desperate. Shantae Addison, Housing for New Hope, Lead Housing Stability Case Manager, one word, resilient. Imani Williams, Families Moving Forward, Family Services Coordinator. Ronald Roper's one word is friends. Daniel Oladele's one word is hopeful. Mary Barr, homeless is devastating. Megan Holmes, one word, capable. Catherine Culhane, Housing for New Hope, one word is ready. Enoch Holloway, Housing for New Hope, Community Housing Resource Manager, one word is hope. Valeria Brown, Program Manager, Housing for New Hope Street Outreach, one word is frustrated. Helen Tripp, Durham County Emergency Services, MIH Program Manager, one word is human. Tawana Brackett, Housing for New Hope and Engagement Specialist. Adrian L'Esperance, Urban Ministries of Durham Workforce Development Manager, often experienced trauma. Malcolm White, Alliance Health, administers the DASH Permanent Supportive Housing Grant for Alliance. One word is overwhelmed. And that's all we have right now.
All right, thank you. Thanks. Again, welcome everyone. We're delighted that you joined us this morning and hope that you will plan to participate in future sessions of this series throughout the year. So our agenda for this morning, we'll review some learning objectives for both the series and this morning. As part of that, setting the context for the series by reviewing some system performance measures. Do a brief review of kind of a system map for the Durham homeless housing system. The bulk of the presentation is going to be focusing on case management thoughts around housing focused case management throughout some key elements of our system. And then at the end, a couple of slides to talk about the entire series coming up. So learning objectives for the series. We at the Community Development Department want everyone connected to Durham's homeless housing system to embrace the concept that effective case management with people experiencing homelessness must be housing focused. If it's not housing focused, it's going somewhere else. And that's housing is the key need for people experiencing homelessness. And our system must really, to be effective, help people resolve that crisis. And then we want to strengthen our understanding and commitment to housing being the platform for delivery of all supportive services. And if that's the case, then any services available to people while they're homeless must really be explicitly oriented to helping people regain permanent housing. So whatever we're doing while people are homeless needs to really focus on helping them regain housing. For today, we're going to talk a little bit about why we've organized the series, strengthen our understanding of how the elements of our homeless housing system work together. But we're really, while we work in different organizations and have different roles within those organizations, really we need to work together because homelessness is a complex reality in people's lives. Here, the various words that people shared to describe people experiencing homelessness suggests that. And so we need to work together. We all can't do everything for everybody. And we want to talk a little bit about defining case management, that role in key elements of the system, how it might vary depending on what role you have. And then we'll provide an overview of the system of the monthly series and solicit concerns and questions that we might address in future workshops. And again, throughout, feel free to use the Q&A box to ask your questions. So to begin, one of the reasons we really wanted to do this series is, I think, out of a recognition that in some ways our system is working well, but in other ways it's not. And to begin, we can always remind ourselves that our goal is that experiences of homelessness should be rare, brief, and non-recurring, or one-time only. So hopefully all of us, or many of us at least, have memorized those three ideas: rare, brief, and non-recurring experiences of homelessness. So let's look at a few of our key system performance measures. This screen shows you a bar chart showing the ratio of first-time homeless and non-first-timers for the last 6 years. I just got the 2020 data for the federal fiscal year that ended September 30th, 2020, earlier this week from NCCH, and so I was able to include that in this slide. I've put the first-time homeless in quotation marks, right? Because those of us who have been around a while know that while HUD uses first-time homeless, it's not quite an accurate description. It really references people who have not been in emergency shelter or transitional housing in the previous 2 years. So somebody who maybe experienced homelessness back in 2016, and then they were housed for a couple of years, and then came back into the system in 2020, they would be considered first-time homeless, although they had a prior experience more than 2 years ago. And I think HUD's understanding is that if they've had that long of an experience of stable housing, it wasn't the fault of or the struggles of the homeless housing system that resulted in homelessness again, but some other things that were happening in their lives. And so you can see one of the good things is that overall our numbers, both of first-time and non-first timers, are declining in our emergency shelter and transitional housing programs, and some significant declines. The number of first-timers decreased 23% between 2015 and 2020. You have the numbers there, hopefully you can see. And even non-first-timers, some of the people that have had recurring episodes of homelessness, has declined 35%, and so an overall decrease from about 1,047 people in 2015 to just 769 people in 2020. And on one level, that can be considered encouraging. Many of us are concerned about exits or returns to homelessness, and this chart shows us that kind of consistently of the people who have exited to positive housing destinations in the previous 2 years, somewhere in the mid-teens return to homelessness. And the reality is, even the best of us cannot tell who will be or won't be successful when we get them back into housing, and we can't predict client resiliency. Some people that we think will not be successful in housing are successful, and others we think they won't be successful. They also turn out to be successful. So, but exits to returns to homelessness has been a consistent measure in the mid-teens over the last several years. This chart shows us exit destinations from emergency shelter, transitional housing, and rapid rehousing, and where they went in terms of two categories. The blue portion of the graph shows exits to positive housing destinations. Generally, these are exits to permanent housing of one kind or another. And the red portion of the bar shows other exits to temporary housing destinations, or perhaps returns to homelessness. And sometimes people who die in shelter, things like that. So, but overall, we are seeing significant exits from positive housing destinations over the years. We'll have to see whether the significantly fewer exits we had in the 2020 fiscal year was an aberration simply because of the ongoing pandemic. But nevertheless, some good exits to positive housing destinations happening. And again, this is another way of showing the information from the previous slide, looking at the percentage of exits that were to positive housing destinations. It had been between 2015 and 2019, hovering between roughly 45 to 60%, mostly in the mid 50s. If we had to do a trend line, would have been kind of stable in the mid 50s, but we had a significant drop off again in the last fiscal year, and time will tell whether that's an aberration or whether it becomes a more long-term trend for our system. I want to move into a couple slides that show the concern that we have at the COC level.
Lloyd, there's a question in the chat box.
Okay, I want to go ahead, share the question, and I'll see if I can answer it.
Ann Tropiano wants to know, are there numbers broken down for families versus singles and returns to shelter? Is this number representing those who returned after an exit to permanent housing?
Okay, this percentage of exits who return to homelessness is specifically focused on people who have exited to positive housing destinations and then returned to homelessness. Okay, I'll be sharing just in one of the upcoming slides a breakdown of comparison of families shelter and singles shelter. But we'll look at that here in the next slide after this one. And hopefully that will answer your question, Ed. So our annual count of people in emergency shelter has been declining over the last several years. And we had a significant decline between 2016 and 2020. But at the same time, and this is a concern, the numbers of people based on our one night count of unsheltered people has been increasing. It wouldn't be a concern, if at the same time our annual count of people entering emergency shelter was going down, that our count of unsheltered people was also going down. That would really kind of suggest that, well, we're pretty much meeting the need for shelter of people in the Durham community. But between 2016 and 2020, we had a significant increase, more than double, close to probably 150% if we do it on a percentage basis. And so we need to ask ourselves, well, why is that happening? Our shelters always seem to be full, and yet we have to prioritize people in the current situation for not just for housing opportunities, but for emergency shelter, because we don't seem to have enough room for them. In our current by name list, not just looking back to a year ago, but our current list suggests we have about 115 unsheltered single adults and 12 unsheltered families in the Durham community, where we don't have an ability to assist them with at least even with, or offer them even emergency shelter. And this is a big reason why. So average and median sometimes confuse people. So to begin, put in the Q&A box this little exercise your thoughts on if we had 5 people with stays in our shelter of 10 days, 20 days, 30 days, 40 days, and 200 days. Again, 5 people with stays of 10, 20, 30, 40, and 200 days. What would be the average length of stay for those 5 people? And what do you think would be the median length of stay for those 5 people? And Ruby, if anybody puts anything in the chat here in a moment, you can call out the numbers. Anybody taking any stab at that?
Malcolm White said median is 30. The average is 60.
Very good.
Maybe that is 15 days.
Thank you. Thank you, Malcolm. That's correct, right? The average takes up all of the total number of nights stayed and divides it by the number of people that have been in the facility. And the median simply puts them across the board and says what was the person who was right in the middle had people staying fewer number of days than that and more number of days. So 30 was the median of the person, but the average is 60. So the data does hide what is happening for emergency shelter projects serving singles and families, but cumulatively, this is the result. However, the average length of time homeless for families in shelter has declined from 144 days in 2015 to 106 days in 2019. I don't yet have the data for 2020, but nevertheless, that's a significant reduction of 26%. So they are heading in the right direction. However, they're still higher than the overall average for the system as a whole. Conversely, where we are struggling as a COC is particularly serving singles and trying to help them have their experiences of homelessness be brief. The average increased from 132% between 2015 and 2019, from 31 days in 2015 to 72 days in 2019. Hopefully that is a source of concern for everyone on the call. It's a concern because, as we suggested in the other previous slide, if we have more unsheltered homelessness, but if our shelters are full, we don't have a place for those unsheltered people to go into. Some people would say, well, that suggests we should have more emergency shelter. Well, let's consider that if the 868 people staying an average of 99 days, they spent a total of 85,932 nights in shelter in the federal fiscal year ending September 30th. If they had stayed the same number, had an average length of stay of 80, like we had in 2015, they would have only had 69,440 nights of shelter. That's a difference of 16,492 nights. And if we divide that amount by 80, the average length of stay, that suggests that if we'd had the same length of stay, we could have sheltered an additional 206 people without increasing shelter capacity. So if more people are staying in emergency shelter, longer periods of time, obviously we can't get as many people through the emergency shelter. And so this is something I think for all of us to really try to figure out, okay, how can we help people have briefer experiences of homelessness throughout our system? And so The critical questions are the projects of the COC structured to help people with housing crisis to either avoid homelessness altogether or to resolve the episode of homelessness quickly? And are all of their projects and case managers and teams committed to case management and supportive services focused on resolving homelessness episodes quickly? We know that we are in a time where there's a lot of pressure on housing across the country and certainly in Durham. We hear frequently we don't have enough affordable housing. Beyond that, we'd like to invite you to write in the chat or in the Q&A box what other obstacles besides the lack of affordable housing in Durham make it difficult for us in Durham to end homelessness quickly. Feel free to write a couple of responses in the chat. And Ruby, as they come in, you might share them. What is making it so difficult, or why is the length of stay in shelter increasing? We're going on time here. I probably need to pick up my pace. 10:34, not too bad.
Ann Tropiano says poor rental histories, low or no income, criminal charges, mental health. Phil Miller says unemployment. Brittany Bass says North Carolina minimum wage and income.
Okay.
Shantae Mills says income. Ricky Gardner, helping people get their identification documents, social security card, North Carolina ID, and also getting them connected to income. Christy Page says living wage and barriers that prevent income. Alexandra Nelson Tomlinson says identification documents. Rosalind Smith says low or no income. Demetria Benjamin, rental increases in Durham. Rebecca Bourgeois, lack of support system.
Okay.
Adrian Lesperance, mental health services.
Great. Thanks for sharing, everyone. We appreciate that. And certainly all of these realities are a challenge, right? And they're ongoing challenges. And so recognizing that there are people experiencing homelessness have multiple challenges many times. They are among the most difficult people to serve because they do have many times multiple needs. And so it becomes even more important that we as a system are working as effectively as we can to address their needs and to help them retain housing. So few thoughts about organizing our homeless housing system. And let's take a look at the structure of a COC. This is perhaps one image of a system. Maybe you want to write in the chat some advantages and disadvantages of a homeless housing system that would be organized like this one. They've got a lot of good things going. They've got coordinated entry lists. They've got transitional housing, got shelter wait lists, drop-in centers, navigation centers, housing, rapid rehousing. Hospitals and mainstream systems are connecting people to transitional housing. Would this be a good system to have? Any thoughts showing up in the chat, Ruby?
Kelly Herbert said youth service center. Everything else is okay, here we go. Christy Page says too confusing, though the right components are there. Ricky Gardner, this system has plenty of options, but there isn't a clear way of navigating it.
Okay. I would say this might have been an image of the way Durham's system was working maybe 15 years ago. And if you would think about it, if you were homeless yourself, how would you want to try to navigate a system like this, right? If you're on the streets or seeking assistance, where do you go? Where do you get started, right? I have often used the image with people that really what we're trying to create in the community is an understanding for everybody that when they have a housing crisis, this is where you go, in the same way as over the decades, we've developed clear understandings in the culture as to where you go when you have a medical emergency. And where you go has changed. When you have a medical emergency, it used to be you just pretty much just went to the emergency room. But what over the last generation, we've developed urgent care centers. So we have options, and generally people many times are being directed and kind of, we have a community awareness of where you go when you have an emergency center, a medical crisis, depending on how serious it is. And similarly, we need to continue to work to do something similar with the homeless housing system. So this slide takes a look at where when a household experiences housing instability and homelessness, gives us an image of where specific interventions should or could be provided, right? So the large triangle suggests that as you move from left to right, the number of people in these various categories of housing crises continues to diminish, right? And gratefully, if you imagine a much larger area to the left of the triangle, that would be all of the households that are stably housed. Hopefully all of us would be in that category, but we have a large category of unstably housed people, and gradually some of those people are at risk of literal homelessness within the next 15 to 60 days. Maybe they're behind on their rent a month or two, and they're worried about becoming homeless or what they're going to do to get caught up on their rent. And in that time period, that's a good place for eviction prevention and community-based prevention services to be provided. And we know Durham has made progress with a great, the eviction prevention work that Legal Aid and I think the Duke Law Clinic are providing. And that's an important service. Moving further to the right, you have people who are at imminent risk of literal homelessness within 14 days. And these are the people that meet HUD's Category 2 definition of homelessness. And for that group, more targeted homeless prevention support and services can be provided. And finally, as you get to the smaller final triangle on the right, you have the literally homeless tonight people, and the dotted lines shows the first night that people move from imminently at risk of homelessness to literal homelessness. And really in that time period, those days, some diversion and or rapid rehousing assistance can be provided. And then for the literally homeless, our housing options are really rapid rehousing and permanent supportive housing. When you think about this diagram, some people might say, well, where does emergency shelter fit in? Well, emergency shelter is an important service, some temporary housing, and it's provided only to people who are literally homeless, right? And so it serves them, but it really does not help them resolve their need for permanent housing unless it is really helping them move into a permanent housing situation. And we'll talk about that further. So in comparison to the confusing diagram that we showed a couple of slides back, we'd like to suggest that this is hopefully a chart, a flow chart, if you will, of what Durham's homeless housing system is intended to move towards and to look like. So that, again, moving from left to right, wherever people are experiencing a crisis of homelessness, or if they're in that 14-day period of imminent risk of homelessness, they can enter and receive assistance from Entry Point Durham or one of our coordinated entry hubs that we are in the process of setting up. And or if they're already homeless and on the streets, they can access street outreach assistance. One of the advantages of working closely with the Department of Social Services is that social services is oftentimes a starting place for people who need public assistance of one kind or another. And so to have Entry Point Durham being available for people experiencing homelessness or at imminent risk of homelessness is a great, I think, benefit for our community. So you can see, as with the Entry Point Durham or hub, the options for helping people there are basically four. Again, it depends on the needs of the household. They can perhaps connect them to other community assistance, mainstream resources, again, depending on the severity of the need for assistance. We're making some progress with diverting significant numbers of households from the homeless housing system with diversion assistance, or we can help them get into emergency shelter or transitional housing, or at least get on the waiting list for those opportunities. And if they are going to be, or actually are reporting that they are unsheltered, Entry Point can work to try to connect them to the street outreach team so that they can continue to provide assistance to them and help them explore housing options that might reduce the length of time that they experience unsheltered homelessness. And then the emergency shelters or transitional housing programs. Right now, Durham only has transitional housing programs for veterans that are funded by the VA's grant and per diem program. But they and our emergency shelters and their street outreach teams can connect people to rapid rehousing and also to more permanent housing opportunities, both market rate housing and subsidized housing of one kind or another. So this is a simplified version. Hopefully it makes some sense. Anybody wants to make a brief comment about whether you think this is accurately describes what we're trying to establish or not, feel free to chime in the Q&A box for a moment.
Mary Barr, did you have a question?
No, I didn't.
Okay, thank you.
Good. All right. So it's important, I think, that many of you on the call are in various organizations and roles. I think it's important that everybody on the call have a sense for at least what we're trying to implement and move towards and get everybody kind of on the same page with what our role is. So moving into a homeless crisis response system, some key principles we'll review as we move into specific conversation about housing-focused case management. But some key principles for our system as a whole is that homelessness is a crisis. Think for a moment about your experience dealing with the pandemic. For some households, the pandemic has been a crisis. Gratefully not for mine, because both my wife and I have been able to continue employment. But when people have lost their job, and the Department of Labor suggests, we still have hundreds of thousands of people losing their jobs weekly and monthly in these times. Unemployment can be a serious crisis, and the longer it goes on, perhaps the more severe it becomes. What we know about people in times of crisis is that our reasoning skills deteriorate somewhat. We can become more emotional. We can become more difficult to think clearly. We're not able to problem solve as easily as we might when we're not in a time of crisis. So homelessness is similarly a crisis, and the resolution for the crisis is safe and stable housing. We want equity in access and outcomes throughout our system. So we want to use the data that we reviewed earlier, as well as the experiences of people, to inform how we provide services to people. We want to provide low barrier access so that everybody can access the assistance that they need, right? Again, if you think about a medical model, if medicine was not low barrier, when people had an emergency, it would be a challenge, right? Somebody shows up at the emergency room with a medical emergency, and the emergency room says, well, do you have insurance, or are you a citizen? And if the medical community would turn people away, that would be a challenge, right? We know we've got challenges with our medical system right now in the pandemic. I'm reminded, that in Los Angeles and elsewhere, word is starting to get out to ambulance services that, EMTs are being told, we can't handle any more people in our hospitals because they're filled. And so you need to triage people and say, get out there on an emergency call, and you think it's likely that this person is going to expire, even if you bring him to the hospital, perhaps don't bring him at all. And what a tragedy that is, right? And so similarly with homeless housing system, we want to make sure that we're providing low barrier access and aren't turning people away needlessly. And then prioritizing people for assistance when it is needed, when we need to prioritize because of our limited resources. Autonomy is important. People have the right to self-determination, and we need to uphold their individual rights to choose. It's been clear in the COVID pandemic that housing is healthcare, and we've been working hard to do the best we can during the pandemic to provide shelter and housing assistance to people to minimize the impact of the pandemic on people who are unstably housed and homeless. But it's always the case that housing is healthcare. So many people, health problems are exacerbated when the longer they are homeless. We want to support community integration. We realize that none of us really is independent and self-sufficient. We rely on the support of the community, and many times what homeless people need as they reintegrate into the community and get back into permanent housing is we need to help them connect to institutions and services in the community that can provide ongoing support to them during and after their housing crisis. And certainly we want to be good stewards of the resources so that we use our resources efficiently and effectively and accountably. We know that nearly all of us are using public and private resources. It's not I think most people on the call work for a nonprofit or work in the public sector. And whether you're using government resources or the donations of donors, people want the resources to be used effectively and efficiently to help people. So why is housing so important? I invite you to put into the chat whether you think this statement from the Economic Roundtable is true. And if you think it's true, say why. And if you think it's not true, say why not. The longer people are homeless, the worse their problems become, making it more difficult and expensive to stably house them. True enough. Any comments? Ruby?
Philip Miller says depends on the individual circumstances.
Okay. Let me share this.
Shanita Mills says, I think the individuals themselves also start to lose hope. Ricky Gardner has agreed. It does depend on the person and what they're going through.
Well, if we believe it's true, it becomes even more important that we are really focusing on our efforts on helping people have brief experiences of homelessness, right? And so when our average length of stay is 100 days or more, it becomes a real challenge for people. And, you know, think about, again, experiencing a crisis, a housing crisis for that length of time. I like to use this quote from Mr. Rhonda Mertz at the Salvation Army shelter in Charlotte. I tell my staff, if you're not talking about housing, you're having the wrong conversation. And that is something I think that all of us can take to heart. So let's move into talking about housing-focused case management. What's it about? How can we do it? What is its role in the various sections of our homeless housing system? So you can see this, and again, these slides will be available, and it is going to be recorded, so I won't read this to you, but we're focusing on resolving the housing crisis as quickly as we can, and that's our overall goal. Some general key features. We'll give you a few slides and apologize to those of you who may say, well, Lloyd presented this stuff back in August when we had a presentation. I have a few slides I have carried over to this because I think we do have some new people on the call, and hopefully it's worthwhile to restate some of these things. But again, the crisis orientation of housing-focused case management and considering homelessness a crisis in a household's life, in a person's life. We are going to have some specific sessions at least planned for workshops completely on trauma-informed care and the idea of progressive engagement as well. We want to focus on meeting the basic needs for stable and safe housing. Again, we're reminded that in terms of crisis, people in crisis oftentimes really cannot effectively respond to things that are not connected to helping them resolve the crisis. So somebody might have a need for continuing education to improve their employability, but when they are homeless, perhaps that's not the time to invite them to take advantage of a training program at Durham Tech, for example. Help them resolve the housing crisis first, and then help them get into Durham Tech. We need to meet participants where they are. Again, it's participant driven. Housing First is not a new idea. Hopefully we are all on board of helping people get into Housing First and then providing the support services they need to maintain the housing. In terms of home-based and remote services, a lot of that has been put on hold during the pandemic. Don't know that anybody is visiting people in these homes, in their homes these days, but part of the reason is we prioritize safety, right? Prioritizing safety for our clients as well as for ourselves and our staff, and that's always important. Progressive engagement can be a challenge. We want to be of assistance to people, and those of us who have been trained as social workers, perhaps licensed clinical social workers, want to be helpful to people, and that's a good thing. But the idea of progressive engagement is to only provide assistance to people based on our awareness and their awareness of how much assistance they need. So we provide more support as we get more evidence that that kind of support is needed. And we want to obviously, again, build community partnerships and support. We really need to build trusting relationships with that have mutual respect with the people that we are serving. And as we talked about, as people shared in the in your opening introductions, was encouraged the number of people that said, homeless people are people and they are human, and they, in that regard, they are more like us than they are different. I'm going to run through some of these slides a little quickly to get through some more thoughts, and then hopefully have some time for some discussion. Housing focused case management is all of these things. Focus on developing housing related goals that emphasize acquisition and housing stability. Something to think about, and maybe think about, and feel free to put some thoughts in the chat, is how do you measure whether a client is stably housed? Those of you who are in rapid rehousing work in particular, how do you measure that? You might share some things, and maybe at the end we can get some thoughts about that. And then always thinking about what services are needed to maintain housing once people get back into it. Again, the laser focus of helping households obtain and maintain housing quickly. What's the difference between a laser light and a regular light? Well, a regular CFL, a compact fluorescent, or another kind of light just lights the entire room, right? Where a laser really focuses that beam of light to such a degree that people are using lasers to cut paper and to do all kinds of amazing things, to take out cataracts in people's eyes, etc. So I haven't figured out yet how to use a laser to end the virus, but nevertheless, lasers really focus the light, and so that single-minded focus on helping people experiencing homelessness obtain and maintain housing quickly can be very important, applicable to all components of our system. And we'll talk about how it might be applicable, or how we believe it can be applicable to these various key components. And again, progressive engagement. The goal is focusing on housing stability, not fixing the client's life. Again, housing focused case management is not focused on helping clients end their poverty, or helping them escape poverty. That's important to be mindful of. Assembling documentation is very important. Something that some of you mentioned is an obstacle to helping to help to for people to get back into housing is they don't have documentation. And so that's a key role for case managers throughout our system. Again, housing-focused case management is a crisis response focused on meeting basic needs. It acknowledges and is responsive to chronic stress, okay? Helping people deal with chronic stress. Think about what are some ways that you have dealt with the stress of the pandemic. And as you're working with people, can some of the tools that you are using to deal with the stress in your life be applicable to the stress that they might be dealing? And maybe you guys can do some stress reduction work together, right? So again, meeting participants where they are, building on their strengths. We're going to have a session later in the year on strengths-based case management as well. I've left some of these slides in from the August presentation because I think it can be helpful to be reminded of what some typical goals of clients can be. And these are broader than, I want to go back to, can be broader than just a safe, affordable place to live. But in the goal setting, these are generally, I think, are goals that most people have for their lives, right? They want a sense of community. They want services that meet their needs. They want to make their own choices for their lives. People realize they need money to live on, and they want to roll in the community and in their family, and that chance for their children and themselves to get ahead. These are, maybe not clearly articulated goals, but I think if we have a trusting and good rapport with clients, we can have a conversation in which many of these kinds of goals will be stated. In terms of building rapport, which is really the initial task of a case manager, wanted to remind us that people experiencing homelessness have a lot of common experiences that we should be mindful of. It's a very traumatic time. I was thinking about, who of us, would be willing to go to Charlotte and stay for a night or two at one of the emergency shelters there. I have a dear friend from Colorado. I've shared this before, that when he would go to Washington, D.C. for like the National Alliance to End Homeless Conference occasionally, he would stay at one of the emergency shelters. I didn't have the courage to do that because I do have some fear about staying in an emergency shelter in Durham or anywhere else. So to recognize people's fears, and to recognize, like, for people who don't want to stay at an emergency shelter, to be in touch with, well, what's that reluctance about, and to help people process that. So these are important things, I think, to keep in mind, and to perhaps discuss with people, and how they can overcome or work through this time in their life. Potential goals. These are some common ones that people may have. And you can see certainly they're larger than just housing, but a lot of these can be built on more successfully once people are back into permanent housing. In terms of making goals with clients, I want to encourage people to really allow your clients to set their goals. It's not your plan, not your priorities. I like this idea of avoiding clients, or setting up clients to fail, right? Nobody likes to fail. So we all make mistakes. We all have different ways of responding to failure, but we need to set our clients up for success and one of the ways to do that is probably to really allow the client to develop the plans and to support them in whatever plans they might have, and write every goal with success in mind. And certainly we know that goals need to be SMART, right? Specific, measurable, achievable or action-oriented, realistic, and time-bound as well. So work with people to take 1 or 2 steps this coming week. What can you do? What will you do between now and next week, and make it really concrete. And goal planning, start with the end in mind. Okay, stable housing. How are we going to make that happen? And this slide presents some various options that can be explored with people for a stable housing situation. And even while a temporary stay with family or friends may not be the ultimate goal, it can be something that can work while people are on the path to securing longer term housing. And sometimes a good case manager can mediate, right? And it's part of the diversion conversation as well, is to help people stay temporarily while they're working to secure long-term housing. So I want to move then into some thoughts around specific housing-focused case management in some of the various components of our system. So people working, street outreach workers working with people on the streets, all of us again work with building rapport and trust with people. That's really key. We need to address people's immediate needs during the winter. We want to do our best to help people stay warm overnight. And so maybe we're supplying coats and blankets and hygiene items, et cetera, that can be important. Those things can help build that rapport and help people realize that, yeah, you do really care and our community is concerned about them. Addressing safety and health concerns, helping people get to medical appointments, or if they have some kind of a medical emergency, getting them connected to the doctor or the emergency room can be important. Using harm reduction strategies as best one can, and begin the development of a housing plan. Again, shared this story that I heard about a street outreach worker who had a reputation in the community for being the housing guru, or in the encampments, people would say, "Oh, here comes Barbara again, the housing lady," right? And so it's not necessarily it's good to keep reminding people that we are focusing on helping them get back into housing. And it's been encouraging. A lot of people, we are making good progress, I think, in helping unsheltered people get into housing. And it's been encouraging to see that they don't need to go into emergency shelter before they get connected to rapid rehousing or other permanent housing. As there's opportunities, certainly completing the standardized assessment tool, VI-SPDAT in Durham, assisting with assembling the needed documentation for housing can be a key role for street outreach workers, referring to shelter and transitional housing as people on the streets desire it. Working through their fears, perhaps taking them to the shelter to visit, to get acquainted with somebody if they've never been there, and then connecting them to rapid rehousing or permanent housing resources. I ran across somebody who said that street outreach workers should operate with a 70-20-10 mindset. So I want to share that. This author suggested that street outreach workers should spend 70% of their time as an outreach worker focusing on helping document-ready people get into housing. 70% of your time should be spent with document-ready people getting them into housing. 20% of your time could be spent on helping people get document-ready, assembling the birth certificates, the credit reports, whatever else is needed, the applications, et cetera. And then 10% can be focused on finding new people to serve. So I might propose that to the street outreach workers. Maybe do some analysis of how you're spending your time and see if that might make sense for you in the way you are serving homeless people. And I think yes.
Ricky has a question. Ricky has a question about the Via Espadat.
Okay.
Ricky, go ahead.
Thank you. So there is an updated version of the VI SPDAT, and I was just wondering if, as a community, if we would be moving towards using that updated version, or are we still going to use version 2? I think the newer version, I think, is more housing focused, but it doesn't make sense for one organization or project to use it if no one else is. So just wanted to see if there were thoughts about that.
That's an important discussion to have, Ricky. I don't want to have it during this workshop, but I think we are envisioning opportunities to have that discussion and to make a decision as a community as to which version we are planning to use. But I appreciate that question, and we'll keep it in mind and raise it up for our team. Okay. So housing focused case management at entry point or hubs. Again, build rapport, assess for safety concerns, right? If people need assistance for safety, make referrals, confirm the imminent risk of homelessness. Certainly our entry point is doing a good job exploring diversion and other public assistance opportunities, and then referring for emergency shelter placement or the emergency shelter waiting list is a key role. In emergency shelters, exploring continued diversion opportunities. It might be the reality that somebody shows up at shelter and they had a new thought about diversion, or perhaps a temporary situation they could stay with that wasn't shared at the at entry point. And so case managers can work with people on those opportunities. And again, completing the standardized assessment, do some further discussion about completing a housing barrier assessment. We talked some about that in the August session. I'm not going to review that here, but that can be really important for a case manager to understand what the housing barriers and what the housing history of the person or household has been. And then developing and implementing housing plans is a key role for case managers in shelters. Beginning to assist with the assembly of needed personal documentation. Again, that can
Lloyd,
take, yes.
There's a statement in the chat. Catherine Cohane, because of SSA, DMV, and ROD are not as accessible as they were pre-COVID, clients are facing even more barriers to obtaining their vital docs. A large portion of our clients don't have them. So I presume that we need to spend more than 20% of time assisting with this.
Well, certainly as you get people into, as you get people into housing, some of the people that 70% of your time, if you're successful getting people placed into housing, you will need to have more time available to help people assemble the documentation and getting them housing ready, right? So if you have a caseload of 15 people and you've got 10 people that are housing ready or have their documents ready, you help those 10 get into housing, then you're going to have more time to work on assisting other people with assembling the documentation. Again, shelter is a temporary residence to bridge people into housing who have no other options. That's why they're coming into emergency shelter. So we need to make sure that we're helping people, and people in shelter should not be waiting on rapid rehousing or permanent supportive housing caseworkers and managers to assist people with housing search and housing applications. That can be going on while people are in emergency shelter. And we talked some too about, I added this idea of completing the exit interview because we still have significant numbers of people who disappear from the system after they've been in shelter for a time. And so case managers need to emphasize with clients that, we're here to help you. And when you are not coming, we want to complete a brief exit interview with you. And if there's a good relationship of rapport with the household or the client, then I think they'll be willing to complete that exit interview so that you can, people aren't just disappearing from shelter. Housing focused case management perhaps is most obviously seen as present in rapid rehousing projects. We know that rapid rehousing is designed to help households exit homelessness quickly. We've got the term rapid in there, so that's a key bit of it. And these are the basic tasks of rapid rehousing. Providing housing navigation assistance, providing rent, financial assistance, moving assistance as needed, and then stabilizing people. Again, assessing people's housing stability is a key part of that ongoing case management that people experience as they participate in a rapid rehousing project. And the resources provided to people needs to be tailored to the needs of the household. And as a system, we are trying to move towards an approach where rapid rehousing assistance and permanent housing assistance, again, is offered without preconditions. We know there's a balance between when we only have so much money to provide. There's that balance of saying, realizing that, well, if we provide $10,000 worth of assistance to one household, we won't have $5,000 of assistance to provide to the next household. And so there is that balance. Again, that's the importance of an approach that uses progressive engagement that says, we're only going to provide the assistance, even the financial assistance that the whole household actually needs, and not anymore, because we want to be good stewards of the limited resources we have. Case plans need to address the barriers to obtaining and maintaining housing. We need case managers in rapid rehousing projects that are available to the landlords. Again, we've talked, I think, previously about kind of the triangle of the relationship that, and one thing that I know landlords appreciate is to have a case manager who can be a support to their tenant, but also a support to the landlord and help stay in touch. So the triangle of relationships between the tenant, the previously homeless household, the landlord, and the case manager. And one of the roles is to help people build up a support network when they're back in housing, and helping them explore, do they want to, is there a new religious congregation they want to connect with, or Parks and Rec in the city has wonderful recreational opportunities throughout the city. So there's a variety of things. So the overall goal of rapid rehousing case management is to help participants obtain and move into permanent housing, to stabilize and get connected. And so again, I invite you to put into the chat some thoughts about when is housing stable. Housing needs, these are some thoughts about it, that housing is safe and habitable. people have the financial means to pay the rent, even if they are cost burdened for a few months. They understand and comply with the lease and are current on their rent and utility payments. They don't have major conflicts with others that could jeopardize their housing. They know what to do if there's lease or house rules compliance challenges. They understand that it's best to work with their landlord to successfully maintain their lease than to develop a conflictual relationship. And they're connected to the needed and desired resources, and there is contingency plans for future housing related crises. And then
Lloyd, there's
finally-
a comment in the chat.
yes, okay.
Beverly McGill says substance abuse is a major problem within the homeless population. Many clients are not able to sustain housing and or employment due to unaddressed substance use issues. Supportive services should include informational substance abuse, educational classes, in addition to employment and housing workshops.
Yep, absolutely. Very true. Thanks for sharing that, Beverly. So a few thoughts about housing-focused case management in permanent supportive housing. We are making progress on move-on strategies, but from the beginning, housing case managers working with permanent supportive housing clients should explore with them what their long-term housing goals and visions are. They can stay permanently in the permanent supportive housing complex, but if they reach a point where really they don't need the ongoing support, maybe a time to explore other housing options for them. And some people can even become homeowners over a period of time as they increase their income and become more stable. We will have a session on documenting disability as a key strategy for housing-focused case managers throughout our system as well. Now we're moving towards the end here, so I'm going to end with a couple of an overview of the series. Again, if you have specific questions, this was just hopefully a presentation to kind of whet your appetite for what is still to come. I know we didn't answer all of your questions, but 2 slides about upcoming sessions. I do have presenters for all of the sessions listed on the screen. Our next session is going to be specifically on trauma-informed care. And we know many clients have many challenges, so we'll have a presentation and a discussion about the specific challenges of working with difficult clients. So if any of these, if you think about things, if you have any questions related to any of these topics or even unrelated questions, feel free to either put them in the Q&A or send them directly to me, and I'll do my best to pass them on to the presenters for a specific series. So this is this is the order of the next several months. And then in the latter part of this year, in the August through December period, we will have sessions focused on these thoughts. And the series is going to end in December with a presentation about self-care, because we know that we can't help anybody else if we're experiencing difficulties in our own lives. And so managing our own time and taking care of ourselves is also a very important reality for the case manager. So it is 11:27. Any final comments? Any other
Lloyd?
thoughts? Yes.
There's a question from Ricky. How do we work as a system to ensure challenging households can access housing? For example, is there a way for community development or the Durham COC to create a resource list or helpful services list? This would help agencies and organizations that serve people experiencing homelessness from spinning their wheels with trying to find resources for clients. Just an idea.
Well, I would say that, Ricky, thanks for that question. It is an important challenge. There are a lot of resource lists out there. I think probably NC Housing Search is the resource that I most frequently refer people to when they're looking specifically for housing. The Network of Care maintains a website that I think stays pretty well up to date, and certainly there's a housing database as well, affordable housing database, other databases. So, if you have specific questions about specific resources, feel free to, let me know. I was maintaining for a while a printed support guide that has kind of fallen by the wayside over the last couple of years, but I would say that Network of Care or, even 211 can connect people to needed resources.
I'll also add on the Durham COC website, there are some COVID-19 resources that have local resources that are available specifically for people looking for help directly, as well as some help for nonprofits and businesses to connect their clients with. It's under the COVID-19 resources tab at the top of the Durham COC website.
Okay, very good. Thank you. Thanks for that. Other questions, comments? Right. Well, again, thanks so much for coming, everybody. Again, we hope this overview kind of just whet your appetite for more specific discussions and presentations to come in this series. We know we need to work smarter. Can't necessarily work harder, because I know everybody is working hard already. We need to figure out ways to work smarter and perhaps more collaboratively to reduce those lengths of stay for people, particularly in emergency shelter, so that if we get people into permanent housing more quickly, we can make more emergency shelter available to others in the currently unsheltered and living on the streets, and in that way do a better job making experiences of homelessness brief in Durham. We know they're already pretty rare, gratefully, and they're generally non-recurring. 80% of them are, but we need to particularly, I think, focus our energies on making experiences of homelessness brief in Durham. Thanks so much. With that, we will end our workshop. Enjoy the rest of the day and have a great weekend. Enjoy the holiday weekend, and let's also be inspired by the example of Martin Luther King Jr. and what he did for our nation in his brief time with us. Thank you. Bye-bye.